Friends from the media, good morning. According to the leading group of COVID-19 prevention control steering group in Beijing, and today we are organizing the 155th press conference on COVID-19 prevention and control. We'll review the latest situation and take your questions. Leading group of the Beijing Municipal Prevention Control emphasized that we have seen cluster outbreak in Beijing City, and all of these confirmed cases are related with the outbreak of Xinfadi wholesale market. So right now we are actually entering into a critical time in the prevention and control. We have made relentless efforts to curb the spread of the coronavirus. And the meeting also emphasized that the Xinfadi wholesale markets have to be closed, and for the surrounding communities have to take close-up management. We will not allow personnel to be go in and out from the communities. And for direct franchisors from the Xinfadi wholesale markets and restaurants in the Xinfadi wholesale markets, all of these places will have to submit samples for detections. And also we have to take external environment sample detection, and also we will conduct a all-rounded disinfection in the Xinfadi wholesale market. Among the close-off management, we have to make sure that we provide sufficient supply to people who are living inside of the community, and also we will conduct supervision and inspection to all the inbound cargoes and the transport flights. And at the same time, we have to ensure supplies for the vegetables, food. And so we will set up a temporary markets alongside with the Xinfadi wholesale markets to make sure that we can ensure the supplies and meet the needs of our people. And the meeting also emphasized that we have to focus on the epidemiology investigation, and we should extend the scope of the inspection and extend the scope of the nucleic acid test and collect more samples for testing. We have to make sure that all people can receive nucleic acid test when necessary. And for people who are living and working in the Xinfadi wholesale markets, we have to run NAT tests to all of those people and to bring relevant staff, relevant people into centralized quarantine. When people have a fever, we'll make sure that these people will be checked with nucleic acid test. We will spare no efforts to save the patients and also to make sure that there's no hospital-acquired infections. At this critical time, please mind your own hygiene and please abide by the requirement for the prevention and control measures in Beijing. So for people who have visited the Xinfadi wholesale market start from May the 30th, please report to your local community and please run nucleic acid tests in local hospitals. And today we have invited two guests to brief us the latest situation of the epidemic prevention and control in Beijing City. Now I would like to introduce the two guests. So we have Mr. Gao Xiaojun from Beijing Health Commission, Pang Xinhuo, the Deputy Director of Beijing CDC. So first, I would like to give the floor to Madame Pang Xinhuo to brief us the latest situation of the confirmed cases of COVID-19 in Beijing. Friends from the media, good morning. Now, I would like to give you an update on the new cases from June the 13th. In the last 24 hours, newly added cases, 36. 1 asymptomatic cases. Among all the confirmed cases, 15 are men, 21 are women, 8 are Beijing residents, 28 are residents from other cities in China, and 30 in Fengtai, 4 in Daxing, 1 in Fengshan, 1 in Xicheng, And also we have 37 people who are working in the Xinfadi wholesale market. 9 people directly or indirectly visited Xinfadi wholesale market. We proactively identified 11 patients, and 25 confirmed cases are identified through epidemiology investigation. The first case, a man, 35 years old. So he is a worker from the Xinfadi wholesale market. He is self-employed and lived in the Xinfadi practitioner working park. And earlier he developed symptoms of fever, coughing, and fatigue. And also he developed a fever at 38.5 Celsius degree. He was identified as confirmed patients and classified as mild cases. The second case, women, 34-year-old, who are working in a restaurant. So she is working in the restaurant that have received all the supplies and inventory from the Xinfadi wholesale market. So on the 8th of the month, this woman developed symptoms of fatigue and coughing. She used to go to Tiantan Hospital and TCM hospitals in Beijing. And after careful evaluation, she was identified as confirmed cases of COVID-19. Number 3 case, woman, 58-year-old. She was retired and also she lived in the Beijing District. So every afternoon, she visited the Xinfadi wholesale market to bring food back home. On the 7th of the month, she developed symptoms. And on the 11th of the month, she went to Xuanwu Hospital and was tested positive in COVID-19. And she was confirmed as the patient and classified as a light symptomed patient. And number 4, a man, 56 years old. She is living in the Beijing District. And on the 4th, he actually visited the Xinfadi seafood market to purchase seafood. On 9th of the month, he was admitted to hospital and visited Beijing Hospital. He was tested positive in COVID-19 and was classified as the light symptom patient. Number 5, woman, 51 years old, also from Xicheng District. Now, she is living in the Xisili compound. And on the 4th of the month, she went to Xinfadi wholesale market to purchase seafood. On the 7th, she started to develop symptoms like coughing, fever. And on the 12th of the month, she was transferred to the Beijing Hospital. And she was confirmed cases and classified as a regular case. And number 5, woman from Zhejiang province. And she worked in the Xinfadi wholesale market and also lived in the Xinfadi employees park. And on the 10th, she started to develop symptoms. And she went to Tiantan Hospital on the 12th of the month. And she also identified as the confirmed cases and classified as the regular case. Case number 7, man, 23, and also he worked for the Xinfadi wholesale market, and he lived in Yingdi home space. And he said there's no symptoms in the past 14 days. And however, during our epidemiology investigation on the 12th, and he was tested positive for COVID-19. And the case 8, 28-year-old woman, she worked for the Xinfadi wholesale market. Now, she lived in the Xinfadi employees park. She said there's no symptoms developed in the past 14 days. On the 12th of the month, according to our epidemiology investigation, she was identified as confirmed cases with regular classification. And next one, 39-year-old woman. She also works for the Xinfadi wholesale market, self-employed business woman. And in the Xiangnan residence compound. And earlier she developed symptoms on the 9th of the month. And on the 12th of the month, she tested positive for the COVID-19, and she was confirmed as a COVID-19 patient and classified as the regular patient. And number 10, also related to the case 9, 44-year-old works for the Xinfadi wholesale market, self-employed businessman, and also live in the same place as the case 9. And on the 10th, he started to develop symptoms of fever, fatigue, and on the 12th of the month, he was tested positive and was confirmed cases of COVID-19 and classified as the regular case. And case number 11, 41-year-old man. He is an employee of a medical institution and also live in the Beijing District. Start from May the 12th to June the 11th. For 6 times, he visited the Xinfadi wholesale market and purchased lamb and beef. And start from June the 11th, he started to develop symptoms of fever and tested positive for COVID-19. He also identified as the confirmed cases and classified as the light syndrome patients. And next case, 42-year-old man. He also works for the Xinfadi wholesale market. Now he lives in the Fengtai District, Tianqiao Junyuan. So on the 4th of the month, he started to develop symptoms and he didn't visit any hospital. On the 12th of the month, we also found this man was tested positive for COVID-19 and he was a confirmed case. And he is classified as the regular case. And next one, woman, 38-year-old. She also works for the Xinfadi wholesale market. And she said in the past 14 days she had no symptoms. On the 12th of June, during the epidemiology investigation, she was tested positive for COVID-19 and was confirmed with COVID-19 patients. Number 14, woman, 42 years old, from Hebei province. She works for the Xinfadi wholesale market and lives in the Xinfadi Employees Park. She did not have any symptoms in the past 14 days. On the 12th of June, during the epidemiology studies, she was tested positive and she was confirmed with COVID-19 patients and classified as the regular cases. Next one, man, 32-year-old. He works for the Xinfadi wholesale market, lived in the Xinfadi employee residence compound. And on the 11th of June, he started to develop symptoms, and the 12th of June, he is tested positive and was confirmed patient of COVID-19 and classified as the light syndrome cases. And next one, man, 54 years old, Hebei province, and he works for Xinfadi wholesale market. He lived in the Xinfadi Employees Park, and he started to develop symptoms on 10th of June. And on the 12th of June, with our testing, he was tested positive for the COVID-19, and he is the confirmed cases and classified as the regular case. Number 17, man, 56 years old, from Xicheng District of Beijing. He works for a shuttle bus company and lived in the Yongling Hutong of Xicheng District. He used to visit the Xinfadi wholesale market and started to develop a fever on the 12th of June. And he used to visit Xuanwu, Renmin, and Haidian Hospital. He was tested positive of COVID-19 and was confirmed case of the patient. And also he is identified as the regular case. Next one, 57 years old. He works for the Xinfadi wholesale market. He lives in the Xinfadi employee markets. And start from the 11th, and he started to develop symptoms. He never went to the hospital. On the 12th of June, with our testing, he was tested positive, and he was confirmed with the COVID-19 infection and classified as the light syndrome symptom. And next one, man, 38 years old, also a worker from the Xinfadi wholesale market, living in the employee park. So he started to develop symptoms on the 11th of June. On June the 12th, he was tested positive for the virus and was confirmed cases as a light syndrome patient. And next one, 28-year-old man. He worked for the Xinfadi wholesale market and lived in the employee park of Xinfadi. And on the 10th of June, he started to develop symptoms of fever, and he never go to any hospital. And on June the 12th, he tested positive for COVID-19. And he is identified as the light syndrome case. And the number 21 case, woman. She works for the Xinfadi wholesale market. They live in the Fengtai District. On the 4th of June, he started to develop symptoms, fatigue, coughing, and she recovered a little bit after rest, but he never went to any hospital. However, on June the 12th, she tested positive for COVID-19, and she was identified as COVID-19 patient with regular case. Number 22, female, 35-year-old from Hubei province. She works for Xinfadi wholesale market. Now she's living in the Tianqiao Junyuan of Xinfadi wholesale market and started to develop symptoms on the 11th of June and tested positive on June the 12th. And she was identified as a confirmed case and identified as the regular case. And next one, woman, 49 years old, from Nantong City, and also is a self-employed businesswoman of Xinfadi wholesale market, and she also lives in the Tianqiao Junyuan of Fengtai District. She did not have any symptoms in the past 14 days. On 12th of June, she was tested positive for the COVID-19 infection and was classified as light syndrome case. And number 24, 46-year-old woman from Haidian District. She worked for an asset management company. Now she lived in the Daxing District, Xihongmen Town, and Yuehai Jiayuan. And on 6th of the day, actually, she visited the wholesale market of Xinfadi. And start from June the 11th, she started to develop symptoms of fever. And on June the 12th, she visited the Tiantan Hospital and Daxing Hospital, and with positive test results of COVID-19, and she was identified as a regular case. The next one, woman, 31-year-old from Baoding City of Hebei Province, and used to work in a Yuquandong seafood market, and she is also a self-employed businesswoman. Now she is living in the Qingta Xiuyuan of Fengtai District. On the 8th of June, she started to develop symptoms of diarrhea and fever, and the highest temperature reached 38.5 Celsius degree. And she actually visited the seafood market for many times. On 12th of the day, she was admitted to Wujing Hospital, and she was confirmed as a regular case of COVID-19. Number 26, 61-year-old woman from Harbin City of Heilongjiang. And she also works in the Xinfadi wholesale market. She's taken up the job as a cleaner. And she said on the 10th of the month, she started to develop symptoms of dry coughing and fever. And on June the 12th, she was tested positive and was a confirmed case. and identified as the regular case. Number 27, 46-year-old woman from Henan province. She works for the Xinfadi wholesale market, and now she is living in the Panja Miao of Fengtai District. Except for insomnia, she said there's no symptoms in the past 14 days. And on June the 12th, with the nucleic acid test, she was tested positive and was identified as a confirmed cases with asymptomatic cases. Case 28, 50-year-old woman from Hebei province, and she works for the Xinfadi wholesale market as a self-employed businesswoman, and she is living in the Xinfadi Employee Park. On the 10th, she started to develop symptoms of dry coughing and not going to the hospital on the 12th of June. She was tested positive for COVID-19 and was identified as confirmed cases and as a light syndrome patient. And case 29, 33-year-old woman. She used to work for the Xinfadi wholesale market, a self-employed businesswoman, and she lived in the Yilan Yuan of Fengtai District. She said there's no symptoms developed in the past 14 days. On the 12th of June, she was tested positive for nucleic acid test. She was confirmed cases with light syndrome patients. Number 30, 29-year-old man from Hebei province. He works for the Xinfadi wholesale market, self-employed businessman, and he lives in the Tianjiao Junyuan of Fengtai District. He said there's no symptoms developed in the past 14 days. On June the 12th, he was confirmed as COVID-19 patient and classified as light syndrome patient. Number 30, 25-year-old man from Henan province. He worked for Xinfadi wholesale market, a self-employed businessman, and also he lives in Fengtai Jingcheng from Fengtai District. He had no symptoms in the past 14 days. On June the 12th, he was tested positive, and also he is a confirmed cases as a light syndrome patient. Number 32, 34-year-old woman from Fujian province. She also works for the Xinfadi wholesale market as a self-employed businesswoman, and she lived in the Xinfadi Employee Park. In the past 14 days, she does not have any symptoms. On June the 12th, she was tested positive for COVID-19 and was confirmed cases with light syndrome patients. Number 33, 50-year-old woman from Hebei province. She works for Xinfadi wholesale market, self-employed businesswoman. Now she lives in the Tianlun Jingcheng in the Fengtai District. She said there's no symptoms in the past 14 days. On June the 12th, she was tested positive and was confirmed case with light syndrome patient. Number 34, 38-year-old man from Anhui province. He works for Xinfadi wholesale market, self-employed businessman, and he lives in the Yilan Yuan of Fengtai District. He said there's no symptoms in the past 14 days. On June the 12th, he was tested positive of COVID-19 and was identified as confirmed case with light syndrome patients. And number 35, 35-year-old woman, a local Beijing resident, and also a worker from the Xinfadi wholesale market and living in the Xinfadi Employee Park. On June the 12th, she was tested positive of COVID-19 and was identified as a confirmed case with light syndrome patients. Number 36, 37-year-old woman, local resident of Xincheng District and living in the Changyangzhen of Fangshan District of Beijing City. So she paid a visit to Xinfadi wholesale market on the 5th of June. She said there's no symptoms developed in the past 14 days. And on the 11th of June, she visited the Shijingshan Hospital and tested positive on the 12th of June. And she also was identified as a confirmed case of COVID-19 patient and was identified as the Light syndrome. I would like to remind all the residents, please form a healthy habit and exercise social distance. And places with poor ventilation, please wear a mask to implement all the prevention and control measures. Now we could see there is an increase of the confirmed cases in Beijing. According to our epidemiology studies, all of the confirmed cases have some travel history to the Xinfadi wholesale market. If you had visited the Xinfadi wholesale market in the past 14 days, please report to the local communities and seek medical assistance to seek local support, and please monitor your health condition. If you started to develop some symptoms, please visit medical institutions, and please wear a facial mask with you and do not take public transportation vehicle. Thank you. That is my update. Thank you for her update. Now let's give the floor to the spokesperson of the Beijing Health Commission, Gao Xiaojun, to brief us on our work to strengthen our work in the fever clinics and hospitals in Beijing City. Friends from the media, good afternoon. Now I would like to brief you on our city's efforts to strengthen the management of the fever clinics and to further manage the nosocomial infection. On June the 11th, we started to see an increase of confirmed cases in Beijing. And for health commissions, we have taken the following measures to strengthen the management of the fever clinics. First, we have required all the medical institutions, including 79 healthcare institutions with fever clinics, and we ask the nucleic acid test should be rolled out to all the patients who have visiting the fever clinics. This is what we call a 1+3 testing. And also we will ask their epidemiology studies. Yes, and we will ask the patients whether they have visited any wet markets or the Xinfadi wholesale markets. And when the patients are waiting for the results, and all of these patients have to abide by our regulations. So we will ask the patients not to form gatherings, and all of the fever clinics have to open and to receive patients in an orderly manner. If we found that there is a big surge of the number of patients, the fever clinics have to report to the upper levels and take a contingency plan to manage the flow of the patients. Second, we will strengthen our efforts in nosocomial management. So we will further implement the 16 measures to strengthen the nosocomial management. In particular, we will roll out trainings to frontline healthcare workers. We will implement the guidelines to better protect our healthcare workers. And to key areas, we have to strengthen our protection to all the personnel so that we can minimize the risks of infection to the healthcare workers. For hospitals who have received COVID-19 patients, we have to roll out all-rounded disinfection, and also we have to screen all of the relevant medical workers to make sure that they are not infected with the virus. For example, for Xuanwu Boai Hospital, they have been receiving COVID-19 patients. In total, we have 79 doctors and nurses are receiving these patients. We have run nucleic acid tests to all of these 79 healthcare workers, and their results shows that they're negative in the test. And on the 11th, we also send out 8 high-ranking officials to provide guidance to the hospital. Going forward, we will strengthen our supervision for the management of the nosocomial infection as well as the clinic fever clinics. We have to make sure that all the patients and the healthcare workers are safe during this critical time. At the same time, we are improving our contingency plan in Beijing from 2020 to 2022. So within these guidelines, we will continue to improve our management of the fever clinics. Thank you. Thank you for Mr. Gao Xiaojun's briefing. Now is the Q&A session. Please identify yourself before you raise the question. With Beijing Daily, my question is to Mr. Gao. In view of the current situation in Beijing, what we need to do to early identify the suspected patients. Thank you for your question. On June the 11th, Beijing recorded the first confirmed cases after 60 days of zero increased cases. As of yesterday, the new increased cases in Beijing stand at 43 cases. So on June the 11th, 1 case, 2 reported on June the 12th, and yesterday, 36 cases. And all of these cases, more or less, have a travel history to the Xinfadi wholesale market. In order to fulfill our needs to early identify the suspected cases, we have already received guidance from the Beijing Leading Group on COVID-19 prevention and control. So we will track down the people who had visited to the Xinfadi wholesale market from May the 30th. We will conduct epidemiology studies to all of these people, and also we will roll out nucleic acid tests to all of those people. And all of these tests will be conducted in an orderly manner. So for people who had visited the Xinfadi wholesale market from May the 30th, please report to your local communities. Also, if you have developed symptoms such as coughing and fever, in particular if you had visited Xinfadi wholesale market, first you have to report to the local community, and second you have to go to your neighboring medical institution for medical assistance. You can dial 120 and take a designated vehicle and to go to the medical institutions for treatments. By doing that, we can reduce the risks of cross-infection. So by doing that, we can early identify these patients and early isolate these people, and these people can receive an early treatment. In order to do a good job in the prevention and control, so the Information Office of Beijing Municipality also send out notifications and reminders through our public WeChat accounts. So by taking this opportunity, I would like to briefly introduce this notification. In accordance of the requirement of epidemic prevention and control, so the Beijing municipal government will roll out nucleic acid tests to all the relevant personnel who had visited the Xinfadi wholesale market since May the 30th. We need to make sure that all these people can receive nucleic acid tests. For people who had visited the Xinfadi wholesale market in the past 14 days, please report to the local communities and receive relevant testing. And the Beijing Health Commission also published a list of 98 medical institutions who have the capacity to run nucleic acid tests. Please coordinate with the Health Commission and respond to the requirement of prevention and control measures and conduct nucleic acid tests. That's the end of the Q&A session. So that is the end of today's press conference, and this conference is organized by the Information Office of Beijing Municipality, and also you can find out more information on our official website. And this is also broadcasting in various of media outlets.
央视新闻客户端、央视财经客户端、中国网进行网络直播。北京广播电视台、北京交通广播、北京。
And also, you can also hear our press conference in our radio broadcast. Thank you all the speakers and thank you all for your questions. That's the end of the press conference. Thank you.